Okay, so continuing on with the health science lecture. Another major component of maintaining health is nutrition and exercise. So that's going to finish up the rest of the health lecture. So this is our final parts to the health component. So we're going to start by talking about nutrition. So nutrition is the biochemical and physiological process by which a person obtains the food necessary to maintain homeostasis and support growth. There are nutrients that we need to consume in the diet in order to stay alive. And those nutrients can be classified as macronutrients or micronutrients. Macronutrients we need in large quantities. Micronutrients we need in small quantities. There are three major macronutrients. The first one is carbohydrates. Carbohydrates are sugars such as monosaccharides, disaccharides, and polysaccharides. Mono means one. Saccharide is talking about a sugar. So a monosaccharide consists of one building block, and those are the building blocks of all carbohydrates. An example of a monosaccharide would be glucose. Di means two. Disaccharides have two sugar molecules that are bound together. An example of a disaccharide is lactose. Polysaccharides, poly means many, that's many individual subunits or building blocks that are linked together. An example of a polysaccharide in people would be glycogen, in plants would be starch. Carbohydrates are most rapidly digested, absorbed, and used for energy or ATP production. They're stored in the liver and muscles as glycogen. Proteins. So another major macronutrient is a protein. Proteins are made up of amino acids. They're the second fastest macromolecule that is digested and absorbed. They're broken down into amino acids, which can either be incorporated into a new protein, used for energy production, stored as fat, or broken down further and excreted as urea waste in the urine. Lipids. Lipids include fats such as triglycerides and cholesterol. They are stored in adipose tissue. Adipose tissue is fat tissue. And they're released as energy-rich fatty acids that can be used for energy production. So this is a diagram showing the cycling of macronutrients, and there's several definitions here that I'm going to go through. So when you take in food, you're taking in carbohydrates, fats, and proteins. We'll start here with the fats. Fats are going to be broken down into free fatty acids and glycerol. Free fatty acids can go into the free fatty acid pool, and then once they circulate through the body, they're usually transported by proteins through the bloodstream. They go through lipogenesis, and they get compacted into your fat stores in your adipocytes. Genesis is the creation of something. Lipo is talking about fat. So when we say lipogenesis, we're talking about the creation of fat, and that would be stored in your fat tissue, in your adipose tissue. Lipolysis or lipolysis. Lysis means to break apart. So if we need energy from these fats, if let's say we have fat stores and we're going to go exercise and we need some extra energy, we are going to take the fat out of our fat stores and they are going to be broken down through the process of lipolysis or lipolysis. And then that free fatty acid pool, they can be used for metabolism or making energy. Going here, back to carbohydrates. Carbohydrates are going to be broken down into glucose because glucose are the easiest molecules to use for energy production. From there, they can go into the glucose pool, and then they can be stored in the muscles or liver as glycogen. In order to go from glucose to glycogen, they go through the process of glycogenesis. So if you see the word genesis, again, that's the creation of. So glycogenesis is the creation of glycogen. So that's when you have excess glucose and you want to store it in the muscles or in the liver as glycogen. Now let's say we need sugar in order to maintain our activities. Like let's say we have a very stressful test coming up and our brain needs some extra sugar. We're going to take the glycogen stores and break down glycogen to produce glucose again. And that process is glycogenolysis. Lysis means to break apart. Glycogen is the first part of that word. So we're breaking apart glycogen to create glucose. Excess glucose is going to be converted to fats through the process of lipogenesis. So this is why it's important to not eat too much glucose, because we can only store so much glucose here in the liver and muscles. Excess glucose is going to be stored as fats. We go to proteins here. Proteins are broken down into amino acids. And the amino acid pool, if we want to make our own proteins using those amino acids, we would go through protein synthesis, and those just become our cellular proteins or body proteins. If we have body protein and for whatever reason we don't have fats or glucose that are left over, then our body's going to have to start breaking down our muscle tissue in order to get the nutrients we need to maintain our life. And that's when our body protein can be broken down to create that amino acid pool. Amino acids make a minimal contribution to energy production, which is why we usually don't do this unless there is a state of starvation. So if you have an anorexic patient, someone that doesn't want to eat, or bulimic where they'll eat and then purge, typically the carbohydrates are going to be used first because they're the easiest to use. Then it's going to start chiming into the fat stores, and eventually it'll start chiming into the protein stores. And this is our body protein. These proteins are in our muscles, and the muscles help us breathe, they help us move, help us digest our food. So if we start breaking down these proteins, it becomes really dangerous. Micronutrients. So there's two major types of micronutrients. We have the minerals and vitamins. Minerals are listed here. These are all the major minerals. And then there's trace minerals that are required in smaller amounts, and those are not listed. Micronutrients, there's water-soluble vitamins and there's fat-soluble vitamins. So these are all the water-soluble vitamins, and then these are the fat-soluble vitamins. The major difference is that people like to consume vitamins, and they think by taking certain supplements of vitamins or minerals that it's going to be beneficial. For the most part, any excess minerals are going to be flushed out of the body. So there's the major minerals can be stored in the body, but the trace minerals usually aren't going to be stored in the body, and they get flushed out of the body pretty quickly through the urinary system. Water-soluble vitamins are also going to be flushed out of the body once they're in excess through the urinary system. So if you consume any excess of these vitamins, it's typically not going to lead to any disease states. They're just going to be flushed out in the urine. But consumption of fat-soluble vitamins, these are stored in the body, so you can overdose on fat-soluble vitamins. Food intake depends on activity level. Overeating and undereating disrupt nutrient homeostasis. Calories are a measure of food's energy content. To maintain a constant body weight, an animal must eat as many calories as it expends. Calories are actually measured in kilocalories. We say calorie, but we're actually referring to a kilocalorie or 1,000 calories. It's just if we write 1,000 on a food label, it's going to be too many zeros and it's going to get confusing. So we report them as just calories, but really it's kilocalories. When a food item has 100 calories, the actual amount of calories in the food item is 100,000 calories or 100 kilocalories. 3 macronutrients make up calories. So you can see on a food label that you have total calories, and then calories from fat, calories from carbohydrates, calories from proteins. So 1 gram of carbohydrate is equal to about 4.1 kilocalories. 1 gram of fat is equal to about 9.4 kilocalories. And 1 gram of protein is equal to about 4.1 kilocalories. So combine those together, depending on how many grams of carbohydrates, fats, and proteins are in the food item, that's how many calories are in that food item. That doesn't mean that's how many calories a person is actually going to absorb from the food. because everybody is going to absorb at different rates, especially at different times in their lives, different ages. They have different absorption properties. That's just saying how much energy is in that food. There is a supplemental video that goes along with one of the labs that you'll learn a lot more about calories and how people absorb calories from their diet. Deprived of nutrients, the starving body digests its stored reserves of carbohydrates, fats, and then proteins in that order. So like I mentioned previously, if you starve yourself, first your body's going to try to consume all the carbohydrates in the body, then the fats, and then finally the proteins. Obesity occurs if calorie intake consistently exceeds calories spent. Poor eating and exercise habits lead to obesity, but genes also influence appetite, digestion, and metabolic rate. Deficiencies of some hormones, such as leptin, may also contribute to the tendency to become overweight. Leptin inhibits hunger, which is made by adipocytes. So if you have a leptin deficiency, then you are likely to become overweight. Here's a list of some common nutritional mistakes. First, focusing on weight alone rather than diet, exercise, and water consumption. A lot of people start to obsess about their weight, and they can even have anxiety and panic about that number on the scale. But everybody has different bone structure and different physiological needs that focusing on that number isn't the best thing to do. So the better thing to do is try to create yourself a healthy diet, exercise, and water consumption plan, and something that you can really stick with. A lot of these short-term diets fail because you are forcing yourself to change how you are as a person, and that takes many, many years to be able to adapt and change to that. But focusing on just that number, that's not a good way to get proper nutrition. Eating infrequently. Sometimes people think that, well, if I only have one meal a day, then I'm going to lose a whole bunch of weight. And that's not true. Your body is going to absorb a lot more nutrients from that one meal because it's going to get used to the fact that you're not having steady food coming into the body. It's going to get stressed and it's going to go into starvation mode. And as soon as you do eat that large meal, it's going to absorb more nutrients from that large meal. So it's really beneficial to eat many small meals throughout the day to keep your metabolism kind of working throughout the day. That also helps you burn more calories because if you're continuously burning or working on digesting that food throughout the day as opposed to one time during the day, you'll have to produce enzymes to break those down and to process those nutrients, and that all can help you lose weight. Unnecessary micronutrient supplementation. So a lot of people take vitamins, which is great, especially at certain times in your life. But if you are doing this in excess, a lot of that is just going to be urinated out. If you've ever seen that show Big Bang Theory, and Sheldon was talking about how she's purchasing all of these vitamins, and he's like, you're just creating really expensive urine. That's pretty much what it is. Supplementing those micronutrients, to a point, it's a good thing, but if you overdo it, you are just going to end up eliminating those through the urinary system. Eliminating one of the macronutrients from the diet. So if you go on a no-fat diet or a no-carb diet, your body needs fats. There are essential fatty acids where if you don't consume them, you can't carry out normal everyday processes. So having a zero-fat diet is really bad for you. No carb diet is another way to cause your body to go into somewhat of a shock. It's really a better idea to have a varied diet as opposed to just eliminating one thing from the diet. Failing to maintain adequate hydration status. So you need water in order to break down macronutrients, among other things, maintaining homeostasis and fluid balance and all that other type of stuff. But if you don't have water, your body is not able to break down those macronutrients. Water is needed to break those bonds. So without water or adequate hydration status, you're not going to be able to break down those macronutrients and eliminate excess. Excessive energy restriction. So if you're not exercising, if you're kind of sitting around If you restrict how much energy you use, that's also a way to make a mistake when you're considering nutritional requirements. So basal metabolic rate, or BMR, this is the minimum number of calories required to maintain vital functions such as breathing, heart rate, and brain function. It helps us determine how many kilocalories we should consume in a day. Typically, we need to at least consume our BMR worth of calories at a minimum every day. There are these new diets like fasting diets where you like skip a day of eating within the week, and those have shown to have some short-term benefit, but in the long term, are you really going to skip one day of eating for the rest of your life? Probably not. You're going to want to develop a diet and exercise plan that is something that you could stick with and be happy with for the rest of your life. Because once you start making these changes, it's really easy to revert back to your old habits. So, eating a minimum of your BMR each day, and then they usually recommend actually eating at least 200 calories over that each day, especially if you're going to be exercising along with dieting. Some factors that affect your BMR: lean body mass increases BMR because it requires more energy to maintain muscle tissue than it does to maintain fat. Growth periods increases BMR. So if you're trying to evaluate the BMR of a child, that's a pretty dangerous thing to do because they're constantly having these random growth spurts and you don't know when those are. So when they come, they're going to need those extra nutrients at that time. Body temperature increases BMR. It requires more energy to raise the body's temperature, plus increased rate of reactions increases the BMR. And hormonal status. So thyroid hormones control metabolism, so a decrease in thyroid hormones would decrease BMR. There are some calculations here that allows you to estimate your basal metabolic rate, so you can review these calculations. It's also a component of the lab, so you can look at the lab there. But also, if you want to just calculate it, there's a really good calculator. If you click this link in the PowerPoint slides, you should be able to get to that calculator and calculate your BMR. Body mass index, or BMI, is different from BMR. Body mass index, BMI, is a number relating a person's weight to their height. It's losing clinical relevancy. So BMI used to be everything. It used to be on every single patient report all over the place. And now they're kind of shying away from even giving that information to patients. But a healthy range is considered to be between 18.5 and 24.9. And there is a link to the BMI calculator if you're interested. And there's tons of tables that look like this one on the right-hand side. Kind of tells you what range you're in. So if you look at your weight in pounds, let's say you're 198 pounds and you are 6'7", you're in the green, you're good to go. If you're 198 pounds and you're only 5'3", then you're kind of getting a little bit in the bad range. So this also shows it height in meters and weight in kilograms as well. But the link to the BMI calculator, you can enter in your information and figure out what your BMI is. Body composition is also going to be different between men and women, and this is something important to make note of. Women typically have more fat in their body. Fat is needed in order to make breast milk, and fat is also needed for pregnancy hormones. Especially if a woman is trying to get pregnant, restricting fat in their diet is a terrible idea. That's one of the first pieces of advice that I give to people when they're like, I can't get pregnant and I'm having a hard time, is, are you dieting? If you're dieting, you can forget about getting pregnant. Start eating fatty foods. Get your body ready to make those pregnancy hormones, and you should have better success getting pregnant. Men typically have a lot more lean body mass, and that's because testosterone is produced in higher concentrations in men than in women. It is produced in both sexes, it's just higher in men. And testosterone typically leads to the development of more lean muscle mass, and that's going to lead to less fat in the body and more of that protein. So moving on to nutrition and cardiovascular fitness. So nutrition has a direct correlation with your cardiovascular system. Your cardiovascular system is talking about your heart and blood vessels. The way that nutrition impacts your cardiovascular system is by how much fat you eat. Now, I did say that fat is required in the body, and if you're trying to get pregnant, it's a good thing to consume some fats, but fats can be consumed in excess very easily, and that's where you start to have issues with your cardiovascular system. Triglycerides. Triglycerides are our basic type of fat. Triglycerides are transported through the bloodstream by proteins. They're protein transporters, and they're going to be transported to the adipocytes in order to be stored as fat, or to the liver so that those fatty acids can be broken down and used for energy production. Sometimes triglycerides can be deposited in the walls of blood vessels, and that's where we can start to develop plaques inside of the blood vessels. So in a normal blood vessel, you can see pictured here on the right hand side, it's open. It's like a doorway that you can just walk clearly through. Once you start developing plaques, which consist of fats and cholesterol, then that narrows the doorway. So just picture a typical doorway, and now picture that doorway, you're starting to put padding around the inside of that doorway. It's making it harder for you to get through. When it becomes harder for you to get through that doorway, the pressure has to be a little bit higher to get you to push through. The pressure is generated from the heart. So the heart pumps the blood through the blood vessels, and if the blood vessel walls are becoming more thin or more narrow, that heart's going to have to work a lot faster to get blood flowing through. So if the heart has to pump harder to push the blood through, that puts strain on the heart. It also increases the pressure inside there, and when you have an increased pressure, there comes with all sorts of risks. So before I go on to talking about these additional risks, I do want to mention LDL and HDL and their impact on cardiovascular fitness as well. So I already talked about how triglycerides can start to build up in the blood vessel walls in the forms of plaques. Well, LDL, low density lipoprotein, is a cholesterol transporter, and its job is to transport cholesterol to your tissues. You do need cholesterol in the body, but typically we have all the cholesterol that we need so that we don't need to supplement it in the diet. So when we have LDL, its job is to take cholesterol and pack it into the tissues. And that cholesterol is used in cells, it's used to make certain hormones. But then if there's any excess LDL, it's going to start putting that cholesterol in your blood vessel walls. Just like triglycerides can start forming plaques, so can low density lipoprotein cholesterol. So that cholesterol is going to combine with the triglycerides, and it's going to form a blockage and go down that path that I just described. HDL, and sorry, the letters were flipped up here, high density lipoprotein. I will fix that in the PowerPoint as soon as I take a look at this. But high density lipoprotein, just fix this now so it's ready. Does the opposite of LDL. So high density lipoprotein is going to take cholesterol to the liver to be broken down and eliminated from the body. So when we look at numbers, we want to have low levels of triglycerides, low levels of LDL, and high levels of HDL. The more HDL we have, the more that excess cholesterol is going to be broken down, and the better our cardiovascular fitness is going to be. Atherosclerosis is talking about the accumulation of plaques inside the blood vessel walls. When you have plaque accumulating in the blood vessel walls, it's going to lead to hypertension. Hyper is talking about more. Hypertension is an increased blood pressure. Myocardial infarction is a heart attack. So how does increased blood pressure cause a heart attack? Well, let's say that we have this happening inside of the blood vessels that feed our heart muscle tissue. So our heart is a muscle. It needs nutrients. And there's blood vessels that'll bring nutrients to the heart muscle itself. So when those blood vessels start to have plaques accumulating in them, What can happen is the plaque can get so big that it actually blocks the blood flow to part of the heart. And when it blocks blood flow, that part of the heart that's served by that blood vessel will be suffocated of nutrients. It won't have access to oxygen or nutrients, and it'll actually die. So when you have a heart attack, part of your heart muscle tissue dies, and that's a myocardial infarction. Myocardial is talking about the heart muscle. Infarction is talking about a blockage. So you have a blockage that's preventing nutrients and oxygen to getting to part of your heart. That heart muscle will never be alive again. It will die, and then it will scar over and turn into scar tissue. A cerebral vascular accident is a stroke. So let's say instead of the blood vessels of the heart getting blocked, let's say the blood vessels of the carotid artery in the neck get blocked. If that plaque dislodges and goes up into the brain, it can lodge into one of those blood vessels in the brain and cause a stroke. If that happens, part of the brain tissue dies, and that again does not grow back. It comes back as like scar tissue. Cerebral vascular accidents or strokes can have some devastating effects. Some people just don't recover from strokes. Other people have severe disabilities after the strokes. If the strokes are minor, though, people can live relatively normal lives after a stroke. Congestive heart failure. Congestive heart failure is when fluid starts to accumulate around the heart because the heart rhythm has slowed and the blood vessels around the heart are starting to become leaky, and that further slows the ability of the heart to pump. After a major heart attack or several smaller heart attacks, you can start to develop congestive heart failure, and the heart has a difficult time beating because it has slowed and there's fluid that's accumulating around the heart. Congestive heart failure is unfortunately a positive feedback cycle that will continue until the heart stops beating. So that typically leads to death, and that's where heart transplants are required. All of this is all associated with increased fat consumption and an increase in cholesterol consumption. So high LDL and low HDL can lead to this. So some diagnostic tests for the lipids. Triglycerides, we want to see less than 150 mg per deciliter, and this is fasting, so after 12 hours of not eating anything, this is the levels that we would want to see. Total cholesterol should be less than 200, LDL should be less than 130, and HDL should be greater than 49. If these numbers are out of whack, then you can start to develop some issues, or you can be considered high risk. So the next time you go to the doctor for a routine physical, you can ask for a fasting lipid panel, and you can learn a little bit more about what your values are and some health tips of how to get these values back to normal. There are certain medications that you can take that will decrease your LDL cholesterol, and just changing to a low fat, not a no fat, but a lower fat diet can greatly improve your cardiovascular health. Exercise and cardiorespiratory fitness. So exercise and movement in general requires energy in the form of ATP. In order to make ATP, we need oxygen. The waste product from making ATP is carbon dioxide. So during exercise, our respiratory rate increases. So our respiratory system is responsible for bringing oxygen into the body and carbon dioxide out of the body. So if we're exercising, we need to increase our respiratory rate so that more oxygen comes into the body so we can make more energy. And because we're making more energy, that carbon dioxide waste is going to be accumulating too. So we need to breathe out to eliminate that carbon dioxide waste. Also, in addition to the respiratory system exchanging gases for us, our cardiovascular system is moving the gases through the bloodstream to our tissues. So oxygen comes into the respiratory system. In the lungs, it travels through the lung into the blood vessels. And from those blood vessels, it gets transported all over the body to all the different tissues that need it. In the tissues, the carbon dioxide is going to leave the tissues and it's going to go into the bloodstream. And the blood is going to carry that carbon dioxide all the way back up to the lungs. and that's where it's going to leave the lungs. So it's going to travel from the blood out of the lung tissue and then will eventually exhale it. So that's the relationship between the cardiovascular system and the respiratory system. The respiratory system allows us to exchange those gases, while the cardiovascular system allows us to transport those gases. So our heart rate is going to increase so that blood can be pumped faster, delivering more oxygen to the tissues to be used to make ATP, and delivering more carbon dioxide to the lungs to be removed. There are two major cardiorespiratory measurements that we take all the time, and then there are several others that we can look at, and those would more be appropriate for actual like health science courses, not this type of survey type course. So in this course, we'll just talk about heart rate and respiratory rate. Heart rate is calculated in beats per minute. You want to find a pulse point to feel your pulse. So this is a diagram of several different types of pulse points. This one in the wrist is probably the most common, the radial pulse point. Carotid is another one in the neck that's pretty common, but these are the locations of the different pulse points. And you can take a look at this diagram after the lecture is done. So once you find your pulse point, you're going to want to feel how many times blood pulses through in 15 seconds. So you want to measure exactly how many in 15 seconds, and then you're going to multiply 4. You multiply by 4 because that gets you to 60 seconds, or how many in a minute. Normal at rest is between 60 to 100 beats per minute. Resting heart rate on the lower end of the range usually indicates better health. So if you have a lower resting heart rate, closer to the 60 beats per minute mark, you're typically in better health. Respiratory rate is calculated in respirations per minute. You want to count how many times you inhale in 30 seconds, and then multiply it by 2 so that you can get to a minute. Normal at rest is between 12 to 20 respirations per minute. Lower than 12 and higher than 20 indicate imbalances. So typically you just want to be within that range to be considered healthy. And pathophysiology. Pathophysiology is the study of the disease process. To maintain a state of good health, it's important to understand and be able to treat pathologies that arise in the body. There are several different subdisciplines within the field of pathophysiology, and those are described in the Career Pathways PowerPoint.